Great, we'll start. I think if any of you are in the RV group, the regular batch group, please share the link over there as well. Okay? So if people wish to join, people can join in. Anyways, I'm recording it. Shall I start? Sure. So, question number, I hope this was clear. The Madura foot one was clear. Okay. Moving further, sporotrichosis I was talking about. It is a dimorphic fungal infection, and it is usually due to thorn prick injury. It is usually due to thorn prick injury, जो आसपास Valentine के आसपास होती है, and therefore it is also known as Rose Gardner's disease. It is also known as Rose Gardner's disease, and important. It will show which type of bodies. It will show star-shaped bodies known as asteroid bodies. Important question आ चुका है. It will show star-shaped bodies or asteroid bodies. ठीक है? Then which vaccine has seroconversion time less than the incubation period for that disease? So seroconversion time is the time taken for production of antibodies. Okay, so the body, so the vaccine will induce some immune response inside the body, and the time taken for production of antibodies is known as the seroconversion time. Very good. And usually the natural incubation period of measles is 10 to 14 days, but the vaccine-induced measles have an incubation period of almost 7 days. Vaccine-induced incubation period is almost 7 days. So measles is the only one disease where the seroconversion time is less than the incubation period, and therefore it is the only one vaccine which can be given in epidemic. Okay, so in epidemic of COVID vaccine is not given. In epidemic of influenza, influenza vaccine is not given. But the only vaccine which can be given in a epidemic, that means in the measles epidemic also we can give vaccine of measles to the patient. याद रखना, ठीक है? No issues with this, anybody? Seroconversion is usually all the other. Okay, all the other usually takes, the vaccine takes 6 to 8 weeks for antibody production, but this is the only vaccine which takes usually 7 days itself. Okay, then lowest center where the patient can go. Lowest center where the patient can go, that means they are actually trying to ask you the lowest level of contact between the patient and the healthcare worker. The lowest level of contact between the patient and healthcare worker in India. That was the question. It is option C, PHC. It is usually a primary health center. That is your PHC. Okay, the health worker which is located at PHC is the health assistant. It is the health assistant. Whereas secondary, so usually the primary level, please remember, the primary level is either a PSC or a subcenter. PSC or a subcenter. Secondary level is usually a CHC, and tertiary level are medical colleges or district hospitals. Disease caused by the given mosquito. Here you can see a mosquito. If I can just zoom it in. So here you can see a mosquito which is usually having a hunchback appearance. And which mosquito usually shows a hunchback appearance? A hunchback appearance is usually shown by Culex mosquito. Hunchback appearance is usually shown by Culex mosquito. And here the mosquito which causes, sorry, the Culex mosquito will transmit which of the following disease? So please remember, it will transmit JE, that is Japanese encephalitis. And the most common Culex causing Japanese encephalitis is Culex tritanurhynchus. It is Culex tritanurhynchus followed by Culex vishnui. Okay, no issues with this. Malaria, as we know, it is transmitted by female Anaphylaxis. It is transmitted by female Anaphylaxis. जिसकी image बहुत बार आ चुकी है. Here the mosquito sits at an angle of 45 degrees. The mosquito sits at an angle of 45 degrees, and the wings will have black spots. The wings will have black spots. That is what is a female Anopheles mosquito. Dengue usually, dengue, Zika virus, chikungunya fever, or Rift Valley fever. Dengue, Zika virus, chikungunya fever, Rift Valley fever, yellow fever. Okay, most of these are usually caused by, most of these, not Rift Valley, but yellow fever, chikungunya, dengue, and Zika virus disease. They are transmitted by Aedes mosquito. They are transmitted by the Aedes mosquito, which has white spots all over the body, therefore also known as tiger mosquito. Okay, yaad rakhna. And anybody, last one, Mansonia transmits. Mansonia is a vector for. Mansonia is actually identified by sparkling legs. Mansonia is identified by sparkling legs. Mansonia is a vector for anybody? Mansonia. So dengue is also called, dengue usually breeds in artificially collected water. Okay? Anopheles is called as a sophisticated mosquito because it breeds in fresh water. Culex is called as a dirty mosquito. Anybody? Mansonia is a vector for Brugian filariasis. Mansonia is a vector for Brugian filariasis caused by Brugia malae. Whereas for lymphatic filariasis, the vector is Culex again. For lymphatic filariasis, the vector is Culex. याद रखना दोनों filariasis important है. Incineration process is used for which color bag? So which color bag is disposed of by? It is disposed of by, very good, yellow. So yellow color bag is usually disposed of by incineration, and the temperature of incineration was once asked. So the temperature of incineration is more than 1200 degrees Celsius. The temperature of incineration is more than 1200 degrees Celsius. Okay. Red and blue bag usually goes for recycling. Red and blue bag जाते हैं recycling के लिए, but before that they are pre-treated with autoclaving, microwaving या hydroclaving. No issues with this. And white container consistence usually go for sharp picks after shredding, which is the principle of PSC, primary healthcare. So this was the one that we already discussed. Okay, so it is appropriate technology only over here. Here you need to choose the correct one. It is appropriate technology. I have given the mnemonic IA. Most cost effective screening test for cervical cancer. Anybody? Most cost effective over here. The recommended nowadays it is via. The recommended nowadays according to the Indian guidelines is via in rural settings, visual inspection with acetic acid. But the common one is pap smear. And the most cost effective screening test for cervical cancer is usually the pap smear. Okay? It is usually the pap smear. No issues with this, anybody? Colposcopic biopsy is usually the investigation of choice, not the screening test. If you want to know about recent malaria transmission in area, then preferred indicator is about. Yes. Via option में नहीं था ना, तो leukocytoin महंगा होता है थोड़ा. So go for pap smear as option. ठीक है? If you want to know about recent malaria transmission in an area, the preferred indicator would be. So annual blood examination rate. I told you it is the indicator of operational efficiency. It is the indicator of operational efficiency. Overall, best indicator is annual parasitic incidence. But the one for recent transmission of malaria is infant parasitic rate. The one for recent transmission of the one for recent transmission of malaria is usually the infant parasitic rate. Next question. A pregnant lady has rabid dog bite with minor scratch. Line of action is. Line of action is. With a minor scratch is present. What should be done? The pregnant lady, it is the same question. Clean the wound with rabies vaccination should be given. No immunoglobulins are required because there is no bleeding. No bleeding, so no immunoglobulins are required. Scratch hai, but bleeding nahi hai. Okay? Please remember this. A person reported to ophthalmic OPD, that is ophtha OPD with vision less than 3/6 in the right eye and finger movement at 1 meter distance in the left eye. His state of vision is, anybody? His state of vision is. Very good. So vision less than 3/60. Vision less than 3/60 or 3/6, you can call it. Okay. That is what is option C, social blindness. It is what is social blindness. That is also the WHO definition for blindness. That is also the WHO definition for blindness. Okay, same. Less than 3/60. India maybe we say it is less than 3/60. Economic blindness is vision less than 6/60. Okay, economic is less than 6/60. And legal blindness is vision less than 1/60. Legal less than 1/60. Manifest means there is no vision, there is only perception of light. That is what is a manifest or absolute blindness. Okay? Yes, not perception. Nothing is there. That is what is a manifest or absolute blindness. A man traveled to Assam. After returning back, he developed fever, giddiness, and on investigation, he was confirmed as a case of Plasmodium falciparum. What is the treatment of choice? What is the treatment of choice? Assam ko gaya tha, sab kuch ho gaya, fever, giddiness, and they have also mentioned in the question that was there, they also mentioned it, the patient had an altered sensorium. The patient also had an altered sensorium. Okay? Ab batao answer. This was the actual question. Man traveled to Assam. After returning back, he developed fever, giddiness, altered sensorium. A diagnosed case of Plasmodium falciparum. Very good. If there is altered sensorium, giddiness, it is a feature of cerebral malaria. And as we know, the most common cause or only cause for cerebral malaria is Plasmodium falciparum. So it is a complicated malaria. Here the option will be IV, artemether, or we can even give IV artesunate. So in most of the options, it is IV artesunate. Some of the options can mention IV artemether. So as if we say the drug of choice for malaria overall, it is definitely the artemisinin-based combination therapy. It is ACT, artemisinin-based combination therapy. If they talk about rest parts of India, it is a artesunate. If they talk about rest parts of India, it is artesunate plus sulfadoxine pyrimethamine combination. Artesunate plus sulfadoxine pyrimethamine combination. वही बता रहा हूँ अभी. And if they talk about northeast parts of India, that is Assam वगैरह, then it is artemether plus lumefantrine. Okay, lumefantrine or artemether, me wale. That is for northeast parts of India. Rest of India, artesunate plus sulfadoxine pyrimethamine. Chloroquine is the drug of choice for malaria in pregnancy. Chloroquine is the drug of choice for malaria in pregnancy. Whereas primaquine, as I told you, it is the drug of choice for relapse. And if they ask you a question which is repeated about malaria, drug of choice for chemoprophylaxis of malaria. Drug of choice for chemoprophylaxis of malaria. If the patient is traveling for less than 6 weeks, it is doxycycline. Patient traveling for less than 6 weeks, it is doxycycline. If the patient is traveling for more than 6 weeks, it is mefloquine. For more than 6 weeks, it is mefloquine. Please remember. Moving further, a patient presented with liver cancer working in grain industry, that is groundnut. Again, the toxin responsible is aflatoxin over here. The condition is aflatoxicose. BOA, that is beta oxylyl aminoalanine, will lead to which adulteration disease? Beta oxylyl aminoalanine will lead to lathyrism. Beta oxylyl aminoalanine will lead to lathyrism in the patient. Okay. Sanguinarine will cause epidemic dropsy. Sanguinarine will cause epidemic dropsy in the patient. It will cause epidemic dropsy in the patient. Okay. Please remember this. No issues with this. Then, which level is taking care of school health in rural care? So, school health is usually taken care of at which level? School health is provided at which level? This was the question. School health is provided at which level? Very good. School health is provided at the level of PSC, primary health care, a primary health center. It is provided at the level of PSC. One more question which was given. Which was the first committee to work on school health? Which was the first committee to work on school health? The first committee to work on school health and the committee to work on comprehensive school health. And the committee to work on comprehensive school health. Two important questions and repeat. The first committee to work on school health was Bhore committee. Very good. The first committee to work on school health was Bhore committee. But the committee to work on comprehensive school health was Renuka Roy committee. On comprehensive school health was Renuka Roy committee. A 30-year-old lady presented to OPD with complaints of pain in the lower abdomen with history of copper T insertion. 3 years back. Ultrasound investigation pit was confirmed that the copper is in the extrauterine space. It is usually in the extrauterine space near the ovary. It is removed by. So the copper T has been displaced from uterus. It went outside the uterus. Very good. Agar uterus ke bahar hai, then it would be removed by laparoscopy. Agar uterus ke andar hi hoti but nikal nahi rahi hai, the thread has been misplaced, then it would have been removed by hysteroscopy. Within uterus is removed by hysteroscopy. Outside uterus is removed by laparoscopy. Okay? By pulling thread, if the thread is visible only. Missing hoga to ultrasound ya X-ray se confirm karoge location pehle. A child presented with history of diarrhea for the last 12 years. The child is severely dehydrated and unable to drink the fluid. What is the management of choice? So this is a very straight liner question. Usually in exam, they will give you a child presented with history of chronic diarrhea. Now for last 12 hours, the child is presenting to you. The mother is saying that the child is unable to drink any fluid or drink any water. Apart from that, there is the skin pinch goes back very slowly. The skin pinch will go back very slowly. Okay, this is the classical case. Okay, and the child looks lethargic, or sometimes the child can be even unconscious. Okay, so these are the features of severe dehydration. And here definitely we will follow the plan C of dehydration. And plan C of dehydration usually says to give 100 ml per kg of fluid. Kitna doge? 100 ml per kg of fluid. Okay, 75 ml fluid, 75 ml per kg of fluid over a period of 4 hours. It is usually given in plan B. Okay, 75 ml over a period of 4 hours is given in plan B. That is done for some dehydration. यहाँ पे severe dehydration है, so plan C followed 100 ml per kg. And which fluid is preferred in cases of severe dehydration? It is option D, dextrose normal saline. Because dextrose is given for nutrition as well. Okay, it is the dextrose normal saline which is given to the child. Okay, रिंगल लैक्टिन नहीं देंगे, IV देंगे डेफिनेटली, इट इज IV फ्लूइड व्हिच इज गिवन, DNS, ठीक है. No issues with this. याद रखना, ORS usually oral fluid is only given in no dehydration, that is plan A. 10 to 20 ml of ORS is given after every stool, that is what is plan A, no dehydration. Some is 75 ml over a period of 4 hours, IV fluid is given, that is plan B, and 100 ml per kg, plan C, severe dehydration, dextrose normal saline. Given condition is due to deficiency of, the following condition is usually due to deficiency of, the following condition is due to deficiency of. So here the deficiency, here you can see it is kwashiorkor, okay, here it is definitely kwashiorkor, okay, and kwashiorkor is predominantly due to deficiency of anybody. Very good, it is malnutrition. And यहाँ पे क्या दिख रहा है, malnutrition दो टाइप का हो सकता है. If there is a prominent rib cage with severely wasted child, बहुत पतले पतले हाथ पैर हो, hairs normal हो, so it is marasmus, monkey like feces, old man like feces. But यहाँ पे कैसी feces है, moon like feces, okay, moon like feces है, along with sparse hairs and a distended abdomen, that is edema है child में. This is what is the feature of kwashiorkor, and therefore it is also called as the fat sugar baby, which was the question. Fat sugar baby भी बोलते हैं usually, ठीक है. No issues with this. So it is due to deficiency of anybody. So please remember, marasmus is only due to deficiency of calories mainly. Okay, marasmus mainly it is calorie or energy deficiency. Okay, it is calorie or energy deficiency. Here it is predominantly due to deficiency of proteins. Please remember, here it is predominantly due to deficiency of proteins. Why I am not marking energy? Because calorie or energy deficiency is only seen in certain conditions of kwashiorkor, not every, because there is presence of fat still. So fat है, that means calories तो है, protein कम है, इसलिए edema हो रहा है बच्चे में. Okay, that is the cause. No issues with this. Protein and energy both are actually deficient in cases of marasmus. Okay, no issues with this. Most common cancer in head and neck region in India. ये तो पता होना चाहिए, सब क्या खाते हैं? And it is the oral cavity cancer. The most common site for oral cavity cancer was asked. Most common site for oral cavity cancer in India, it is the buccogingival sulcus. It is the buccogingival sulcus. But overall, worldwide, the most common site for oral cavity cancer is the lateral border of tongue. Overall, it is the lateral border of tongue. Then a 30-year-old person is coming from China with suspected COVID symptoms. Test for confirmation is, this is a very easy one. सबको पता है तो. CB-NAT. CB-NAT is the test, that is cartridge-based nucleic acid amplification test. It is the diagnostic test for tuberculosis or TB. It is RT-PCR, okay, real-time polymerase chain reaction. RT-PCR is the diagnostic test for COVID, okay. Please remember this. This was the image which was given. A graph was given. नीचे लिखा हुआ था RT-PCR. They just asked it is done for which infection. August का question है. No issues with this. HIV के लिए best test if they ask you. HIV के लिए best test if they ask you. Either nowadays you can do a PCR या फिर it is the Western blot assay. It is the Western blot assay. No issues with this. Western blot, Northern blot नहीं. Western blot will detect the proteins. याद रखना, ठीक है? Agency funding TB program in India. Agency funding TB program in India. It is not WHO, not WHO. It is UNAID. Please remember, it is UNAID. Please remember, it is UNAID. Okay, please remember, it is UNAID. That is United Nations Monetary Fund है ये. Okay, they help the developing countries to overcome some of their crisis they are facing in healthcare sector. Okay, that is what is UNAID. ठीक है? It is not WHO. Which agency gives support to achieve sustainable development goals? ये हमने देख चुके हैं. Sustainable development goals are given by, or which agency gives sustainable development goals usually? It is very good. It is the United Nations, but it is the subunit of United Nations known as UNDP, United Nations Development Project. It is United Nations Development Project, which actually supports the sustainable development goals. ठीक है? Sustainable development goals. ठीक है? याद रखना, total 17 है. And एक बारी यूनिसेफ का बस आई एम टेलिंग, C stands for, तो C stands for children. United Nations Children Emergency Fund. वो एक recall question है. A case control study was done to know the risk factors of obesity. What should be the groups taken? So there should be a group of cases and group of controls. So please tell me what should be the group for a case control study. Case control is a backward looking study. Matlab, you will take the cases and then we'll study the history of exposure. Then we'll study the history of exposure. No issues with this? Very good. It is A. मैंने क्या बोला, स्टडी में कौन लोग हैं, केसेस लोग हैं ना, the diagnosed people. Okay, so patients with and without obesity. Without obesity are controls, with obesity are cases. Okay, and इनमें तुम history taking करोगे. That is what is a case control study. All of these are risk factors. With or without online food, with or without exercise, with or without smoking, and then you will take these people and then you will follow them. Then it becomes a cohort study. Okay, then it becomes a cohort study. Risk factor to disease is a cohort study. यहाँ पे हमें जाना है disease to risk factor. Then it becomes a case control study. Doctors are doing work and extracurricular activity. Same question was asked in this exam also. Control group will consist of need PG में था एक बार, इस बार question. Doctors are doing work and extracurricular activity. Study design plan to know for future requirement of doctors which are doing extracurricular activity. As I always told you, post benefit analysis is evaluation of a health program in terms of monetary results. Okay, it is evaluation of a health program in monetary results. Cost effective analysis is evaluation of a health program in cases of the results achieved. Okay, cost effective analysis, it is the evaluation of a whole program with the help of results which are achieved. Okay. Network analysis can be of two types. Either it is a PERT or it is a critical path method. Okay, it is either a PERT or a critical path method. This one is a system analysis. Systematic नहीं होता, it is a system analysis. याद रखना. Answer is option D. As I have told you, किसी भी professional group में अगर if you are trying to see maybe anything, okay, if you are trying to study any factor in a professional group, in any working group, so definitely it is a system analysis. ये याद रख लो, ठीक है? बाकी कुछ याद रखने की जरूरत नहीं. Which of the following anti-diabetic drugs? Yes, same option, that is linagliptin. This is also the same one. Change warfarin to heparin. Which of the following drugs used in emergency management of asthma does not act by causing bronchodilation? Recent one. Which of the following? Very good. It is option D, hydrocortisone. Hydrocortisone does not act by causing bronchodilation. हमें पता है salbutamol is a short-acting beta-2 agonist. Ipratropium bromide is a cholinergic drug. Ipratropium bromide is a cholinergic drug. Okay, derifylin, sorry, cholinergic blocker, muscarinic blocker. Whereas derifylin also belongs to the theophylline group. Derifylin is nothing but the theophylline. All of these will act by bronchodilation except hydrocortisone. So hydrocortisone का mechanism of action क्या होगा? It will inhibit the rate limiting enzyme. It will inhibit the rate limiting enzyme of arachidonic acid metabolism. कौन सी होती है rate limiting enzyme of arachidonic acid metabolism? Yes, IPRA is the safer drug to be given in pregnancy. Nowadays we start with LABA. ठीक है, पहले LABA देते हम, long acting beta 2 agonists like salmeterol. Then we add usually inhaled corticosteroids. If they ask you the drug of choice for acute attack of asthma, SABA. Drug of choice for prophylaxis or prevention of asthma, inhaled corticosteroids. याद रखना. Very good. It inhibits phospholipase A2. याद रखना. Phospholipase A2 is the rate limiting enzyme for arachidonic acid metabolism inhibited by steroids, and that is what is hydrocortisone. याद रखना. So it will not lead to formation of leukotrienes. Okay. Otherwise, we can also give leukotriene antagonist. We can give leukotriene antagonist, and these are drugs known as montelukast या zafilukast. Montelukast या zafilukast. An important question: a 5-lipoxygenase inhibitor used in asthma. दो बार का question है, repeat. A 5-lipoxygenase inhibitor used in asthma. So this 5-lipoxygenase is the enzyme which will convert arachidonic acid to leukotrienes. So either steroids दो या फिर 5-lipoxygenase inhibitor दो या फिर montelukast zafilukast दो. ठीक है? So this is one is known as xylutone. This one is known as xylutone. And a monoclonal antibody used in asthma. Monoclonal antibody, this is also known as omalizumab. Important guys, I will request you to just see once कि ये monoclonal antibodies वाला फंडा क्या है. At least the common ones, because आजकल बहुत पूछ रहे हैं वो. Okay, at least the common ones: infliximab, omalizumab, okay, cetuximab. So these are the important ones. Which of the following is the action of dopamine at low doses? Dopamine at low doses. As we know, dopamine at low doses will stimulate D1 receptors, then alpha-1 receptors, and finally the beta-1 receptors, and then finally the beta-1 receptors. Usually at low doses, it will less than 2 milligram per kilogram. It will cause पहले वेजो कंस्ट्रिक्शन करेगा and then फिर वेजो dilation करेगा. That is what is it causes vasoconstriction usually in the earlier stages. In low doses, it causes vasoconstriction, followed by at higher stages, it can lead to vasodilation. No issues with that. कोई दिक्कत नहीं है. Very good, very good. Yes. Positive inotropic action तब होगी when it will stimulate the beta-1 receptor. ठीक है? Sorry, पॉजिटिव क्रोनोट्रोपिक एक्शन कभी नहीं होती डोपामिन की. पॉजिटिव आइनोट्रोपिक एक्शन होती है. आइनो इज इंक्रीजिंग द कॉन्ट्रैक्टिलिटी. इट इज इंक्रीजिंग कॉन्ट्रैक्टिलिटी. क्रोनोट्रोपिक इज इंक्रीजिंग द हार्ट रेट. सो डोपामिन increases usually the inotropic action. Chronotropic कर सकता है, but more predominantly causes increasing inotropic action. A female patient presented with pain and redness in the grade. This is the same one, guys. Gout, xanthine oxidase. Vitamin that increases absorption of iron from stomach. Answer is easy. It is option C, vitamin C. Yeah, farther more than 10, it will show inotropic action. Okay? It will cause contraction of the heart. Longest acting phosphodiesterase inhibitor among the following drugs is. So phosphodiesterase 5 inhibitors are usually drugs like sildenafil, tadalafil, all of these. The longest acting one out of this is tadalafil. Okay, longest acting one is the commonly used is sildenafil. Yaad rakhna. And all of these drugs, phosphodiesterase 5 inhibitors, are used for erectile dysfunction. These are the drug of choice for erectile dysfunction, and it can be also used for anybody. Phosphodiesterase inhibitors are also used for which type of hypertension? Phosphodiesterase inhibition. Very good. These are also used for pulmonary arterial hypertension. These can also be used for pulmonary arterial hypertension. But the drug of choice for pulmonary arterial hypertension would be either calcium channel blockers या फिर endothelin antagonists like bosentan. No issues with that. Which of the following statements about these drugs is true? So क्या दिख रहा है? ये 4 drugs दिख रही है, and you have a log DRC. I know, and as we know, log DRC, ये question था, it is sigmoidal in shape. Okay, like log DRC is also sigmoidal in shape. तो यहाँ पे क्या दिख रहा है? As we know, important 3 features. फिर से एक बार revise करते हैं. Potency of a drug is determined by the side of the graph. The graph on the left side is more potent. The graph on the right side is less potent. ठीक है? So potency is determined by the side of the graph. Efficacy of a drug is determined by the height of the graph. Efficacy is determined by the height of the graph. Whereas the safety of a drug is determined by the slope of the graph. Safety of a drug is determined by slope. So यहाँ पे वो क्या बोल रहे हैं? Drug A is most potent. So the drug A is the most potent. Yes, this is the right statement. It is the most potent out of all. Next says drug A and B have equal efficacy, but A is more potent than drug B. ठीक है? So यहाँ पे drug A and B has equal efficacy. So यहाँ पे उन्होंने false statement पूछना चाहिए था actually. ठीक है? So drug A and B have more efficacy or equal efficacy. And drug A is more potent than drug B because drug A is usually towards the left side. याद रखना. Drug C is the least potent one over here. So drug C is the least potent. Yes, drug C is the least potent. Drug B has more potency but less efficacy than drug A. So drug B is not on the left side. So it is less potent, not more potent. Okay. So it is less potent, not more potent. And it has less efficacy than drug A. No, it has same efficacy as drug A. ठीक है? तो यहाँ दिख रहा है ना? Drug A and drug B are almost at the same level, so they have the same efficacy. But as drug A is on the left side, therefore it would be more potent. Whereas B, as it is on the right side, it would be less potent. So यहाँ पे not the true statement, rather you had to identify the false statement. Okay? So what is the false statement? Answer D. Which of the following antidepressant drug acts by inhibiting the reuptake of both serotonin, and this is the same one, venlafaxine. Drug of choice for treatment of digoxin-induced ventricular arrhythmia. So this was the question. Similar question came in this one, right? So the drug of choice for digoxin-induced arrhythmias or ventricular arrhythmias is option B, that is lidocaine. If this is not an option, the other answer is phenytoin. Other answer is phenytoin. Yaad rakh dena. No issues with this. If the patient has an unstable BP, BP, that means the patient is hemodynamically unstable, then you can even use cardioversion. No issues with this. So BP stable है, तो lidocaine या phenytoin. Unstable है, hemodynamically unstable patient, then DC cardioversion. Okay, the most common type of digoxin induced when the arrhythmias are usually ventricular bigeminy. The most common ones are ventricular bigeminy. Whereas most characteristic are non-paroxysmal atrial tachycardia with AV block. This time there was a question, guys, in NEET PG examination. A patient on digoxin therapy now presents to you usually with complete heart block, third degree or complete heart block. अब ये तो bradyarrhythmia है. So in this, definitely lidocaine, phenytoin, या DC कुछ भी नहीं कर सकते, right? Nothing can be done in bradyarrhythmia. All of these drugs are usually used for tachyarrhythmia. So for a congenital heart block, we can give a digoxin antibody, and this digoxin antibody is what is known as digibind. It is known as digibind. Okay? That was the option. Procainamide is used for WPW syndrome. याद रखते हैं. Amiodarone पे भी आऊंगा. I'll tell you about amiodarone. That there was a question. Okay. Isotope of iodine used for treatment of thyroid cancer is. Yes, for bradyarrhythmias we can give pacemaker. For bradyarrhythmias we can give implantable pacemakers usually. So it is for treatment. For treatment purposes we will use iodine 131. For treatment purposes we can use iodine 131. Whereas iodine 123 या बाकी सब के सब are used for diagnosis. They are used for diagnosis. The half-life of iodine 131 is 8 days. Half-life is 8 days, and it will destroy the thyroid follicles by emitting beta rays. It will destroy the thyroid follicles by emitting beta rays. And after this radioactive iodine therapy, the patient will need lifelong thyroxine supplementation. Therefore, it is avoided in young patients less than 35 years of age group. Okay? And half-life of iodine 123, which is used for diagnosis, is only 13 hours. Okay? It is only 13 hours. So, कम time के लिए है, इसीलिए usually it is used for diagnosis. A patient, this is the same question of malignant hyperthermia, guys, caused by halothane. Calcium is the cause. A lady was stung by many bees. She developed breathing difficulty and hypotension. So breathing difficulty is usually due to laryngeal edema. Hypotension is usually due to vasodilation, which is caused by histamine, which is the chemical mediator. So this is actually a case of anaphylactic shock. If only there is features of angioedema, then it would be anaphylaxis. But agar uske saath saath low BP bhi hai, then the answer over here is anaphylactic shock, which is caused by histamine. The drug used for the treatment of this condition is option A, adrenaline or epinephrine. मैंने बताया intramuscular 1:1000 dilution. Next one, याद रखना, noradrenaline is used for two types of shocks. Noradrenaline or norepinephrine is used for two types of shocks. Please remember, it is used for septic shock. It is the drug of choice for septic shock and cardiogenic shock. It is the drug of choice for septic shock and cardiogenic shock. No issues with the septic shock. Most definitive is definitely antibiotics, but the drug of choice is noradrenaline. A patient presented to hospital with road traffic accident. The patient has raised ICP without intracranial hematoma. Which of the following is the preferred drug for the management of this patient? अगर कोई hematoma नहीं है, कोई bleed नहीं है इस patient में, so no active bleed, so no contraindication of mannitol. And the drug of choice for raised ICP or cerebral edema is definitely IV mannitol. It is definitely IV mannitol. No issues with this, please remember. Okay. Glycerol can be given, but it is usually given along with mannitol. It is not a single best of choice. Single best answer is mannitol in this case. Prednisolone is also given for cerebral edema, but in cases of meningitis, not otherwise. A patient of COVID-19 requires oxygen therapy. Which of the following cylinders should be used to provide oxygen to this patient? So definitely if the patient needs oxygen therapy and the oxygen cylinder color is black body and white shoulder. It is black body and white shoulder. What is the pin index for oxygen? Anybody? So a completely blue cylinder is the nitrous oxide cylinder. A completely blue cylinder is the nitrous oxide one. And with a blue body and white shoulder is the Antonov cylinder. Blue body and white shoulder is the Antonov cylinder, which contains nitrous oxide plus oxygen. Nitrous oxide plus oxygen. Pin index of Antonov is 7. Pin index of Antonov is 7. Very good. Nitrous oxide का pin index कितना होता है? 3.5. Nitrous oxide का pin index होता है 3.5. Oxygen का pin index होता है 2.5. Oxygen का pin index होता है 2.5. Air का pin index होता है 1.5. Air का होता है 1.5. Okay. Yeah, orange ही लग रहा है. So if it is a brown cylinder is for helium. Brown cylinder is for helium, and orange cylinder is usually for cyclopropane. Orange is for cyclopropane. No issues with this. A drug addict patient presented with agitation and ulceration on the skin. The patient had severe itching and scratch marks on the body. एक सेकंड में मेरा फोन डिस्चार्ज होने वाला है. Okay, it is the same question. Yeah, I need to see the comments. Yeah, chat. Okay, I'll move further. In the meanwhile, chat is on. Okay, so here the diagnosis is cocaine toxicity, definitely. Okay, a patient presented with weakness of the limb muscles, especially in evening after work. So progressive weakness in the muscles along with progressive ptosis, progressive worsening of symptoms usually in the evening, along with progressive weakness of limb muscles, and the symptoms usually improve after a hydrophonium test or a tensilon test. The person is likely suffering from a autoimmune condition known as myasthenia gravis. The patient is suffering from myasthenia gravis. So worsening of symptoms over a period of time from morning to evening, along with ptosis, unilateral or bilateral ptosis. The test we do to differentiate it from cholinergic crisis is the epsilon hydrophonium or the tensilon test. But the investigation of choice is a single fiber electromyography, and drug of choice is pyridostigmine. Drug of choice is pyridostigmine. Please remember this. Okay? Lambert-Eaton syndrome, here the patient will have muscle weakness, but usually on repetitive nerve stimulation, it will show an incremental response. It will show an incremental response. Guillain-Barré syndrome, there would be history of Campylobacter jejuni infection, and there should be a bilateral ascending symmetrical paralysis. Bilateral ascending symmetrical paralysis. A patient on treatment of myasthenia gravis presents with increasing muscle weakness. Which of the following drug is used to differentiate myasthenia gravis from cholinergic crisis? As I already told you, it is the tensilon test which is done. And for tensilon test, we use the shortest acting cholinergic drug, and that is what is option A, hydrophonium. The shortest half-life is of hydrophonium. ठीक है, इसीलिए वो यूज करी जाती है. Pyridostigmine is the longest acting, and therefore it is the drug of choice. A man traveled to Assam. It is the same one. Fever, chills, rigors, altered sensorium. So it is IV artesunate should be given in the patient. ठीक है? Again, cerebral malaria. Patient had a history of previous child with Down syndrome, currently on lithium. So it is again Epstein's anomaly. Repeated questions here. Good. So here also, the substances maintaining calcium balance are vitamin D, calcitonin, and PTH. Which of the following drugs can be used for the treatment of undescended testis? Important question. Which of the following drugs can be used for treatment of undescended testis? Anti-MIH therapy से कुछ नहीं होगा. Anti-MIH therapy कर सकते हो, but कुछ नहीं होगा. Testosterone is for secondary sexual characters. Here we will use GnRH. Okay, here we will use GnRH. Please tell me GnRH in continuous fashion or pulsatile manner. GnRH in continuous manner or pulsatile manner. This is important. If there is delayed puberty in a patient, very good. They should be given in a normal pulsatile manner. That will induce the descent of testis. Okay? After eating an unknown plant, child present in emergency in comatose state. Pupils were dilated. That is mydriasis. The skin was dry. That means it is a sympathetic poison. Okay? Sympathetic poison is because the pupils are dilated. That is mydriasis along with dryness of skin. Body temperature is raised and the heart rate is high. These signs and symptoms. So body temperature is raised. Again, metabolism is high usually in sympathetic activity. Heart rate is high. That means there is tachycardia again in sympathetic overactivity. These signs and symptoms can occur with the intake of which of the following substance? So it is definitely option is Dhatura. So Dhatura, as we know, it is a sympathetic poison. 8 Ds of Dhatura are there. Okay, all of the 8 Ds of Dhatura are there usually that you need to remember, right? So yeah, similar poisoning would be Atropa belladonna poisoning. That is what is called as atropine poisoning. Okay, poppy seeds. Poppy seeds. We derive opium from poppy seeds. And opium toxicity mein kya hota hai? Pupils are not dilated. Rather, they would be meiosis. That is pinpoint pupils. So pinpoint pupils would be seen in cases of opioid poisoning along with respiratory depression. Okay, these are the features. No issues with this, anybody? So yaad rakhna, this is Dhatura poisoning, and the drug of choice for Dhatura poisoning or atropine poisoning is Physostigmine. The drug of choice for Dhatura or atropine poisoning is Physostigmine. A farmer presented to emergency with garlicky odor, pinpoint pupil, excessive secretion. इसको बोला जाता है सरकारी, ठीक है। Farmer presented to emergency with garlic odor, pinpoint pupils, excessive secretion, that is increased lacrimation, increased salivation, increased urination. Okay, which of the following is the drug of choice for treatment of this poisoning? So this is a cholinergic poisoning. Arsenic poisoning नहीं हो सकता, या arsenic poisoning में garlic odor तो होता है, but not pinpoint pupils, not excessive secretion. So this is a cholinergic poisoning, and this cholinergic poisoning is due to a irreversible inhibitor. It is due to an irreversible inhibitor of acetylcholinesterase enzyme. It is due to an irreversible inhibitor of acetylcholinesterase enzyme. I told you garlic की smell arsenic में भी दिखता है, phosphorus में भी दिखता है. तीसरा जो बताया था, it was OPC, right? Organophosphate and carbamate poisoning. So here the diagnosis is OPC poisoning. Farmer insecticide पी के आएगा, तो क्या होता है insecticide में? OPC. So OPC, as we know, it is an irreversible acetylcholinesterase inhibitor. Okay, important. And what is the drug of choice? So the life-saving drug in OPC poisoning is definitely atropine. It is definitely atropine. Please remember this. Okay, important. And the most specific drug for OP poisoning, the most specific drug for OP poisoning is definitely oxime. That is pralidoxime. Okay, so that is pralidoxime. It is the most specific drug, but not the drug of choice. Drug of choice is atropine. And please remember, pralidoxime is only given in OP poisoning, not in carbamate poisoning. It is only given in organophosphate poisoning, not in cases of carbamate poisoning. Flumazenil is the antidote of choice for benzodiazepine toxicity. Flumazenil is the antidote of choice for benzodiazepine toxicity. And this was the question in NEET PG examination. Don't judge it. N-acetylcysteine. So there was a case of paracetamol toxicity. What is the antidote of choice? So for PCM toxicity, the antidote of choice is N-acetylcysteine. The antidote of choice for PCM or paracetamol toxicity is N-acetylcysteine. Okay, all of these are questions. No issues with this. Please remember. An elderly male developed the symptom. Atropine के बारे में मैं एक बस mnemonic बता रहा हूँ मेरा वाला. So A goes for AV block. A goes for AV block. B goes for bradycardia. C goes for cycloplegia, usually in children, and OPC goes for OPC poisoning. Over all these cases, atropine is the drug of choice. In all these cases, atropine is the drug of choice. An elderly male developed the symptoms of dementia and was diagnosed as Alzheimer's disease. Which neurotransmitter level is reduced in this case? So if there is Alzheimer's disease, definitely there is deficiency of acetylcholine. There would be deficiency of acetylcholine in the patient. And which is the most common site affected? So that was the next question. Which was the most common site affected? It is the site where there are excess of cholinergic neurons. कहाँ होते हैं वो cholinergic neurons? It is the site of, it is the nucleus of Maynard basalis. It is the nucleus of Maynard basalis. It is the nucleus of Maynard basalis. Whereas in cases of Parkinsonism, there would be deficiency of, in cases of Parkinsonism, there is deficiency of dopamine. In cases of Parkinsonism, there is deficiency of dopamine. And the most commonly affected site is the substantia nigra. In Parkinsonism, there would be pallor of substantia nigra. Yes, Alzheimer's causes cortical dementia. Parkinsonism is the most common cause of subcortical dementia. Very good. An elderly patient presented with tremors, rigidity, bradykinesia. Most likely neurotransmitter affected in brain of this patient. So resting, pin rolling tremors, rigidity, upper limb में cogwheel rigidity, lower limb में usually lead pipe rigidity, and slowness of movement, that is bradycardia. All of these are the triad of Parkinsonism. And what is the neurotransmitter deficiency in Parkinsonism? As I told you, it is option A, dopamine, which will lead to pallor of substantia nigra. ठीक है, gross biopsy पे. And gross biopsy अगर तुम Alzheimer's की करोगे, there would be cerebral atrophy. ये इमेज आई थी, brain के एकदम छोटा छोटा हो गया है. That is cerebral atrophy of brain is caused in Alzheimer's. Whereas pallor of substantia nigra is a feature of Parkinsonism. Which of the following combination of seizure and its first line drug is not correct? So as we know, for generalized tonic-clonic seizures, or for myoclonic seizures, or for otonic seizures, okay, or for tonic seizures, or for juvenile myoclonic epilepsy, the drug of choice is same, that is valproate. Or even for absence seizures more than 4-year-old, the drug of choice is valproate. Okay? Myoclonic के लिए topiramate is not the drug, first line drug. Okay, myoclonic seizures के लिए topiramate is not the first line drug. Focal seizures के लिए, yes, levetiracetam is the safest drug which can be used. The other drugs which we use is lamotrigine in elderly, and the drug of choice for focal seizures is usually carbamazepine. It is carbamazepine. We can even use oxcarbazepine or phenytoin as well for focal seizures. Okay? Absent seizures, ethosuximide, definitely less than 4-year-old, we use ethosuximide in the child. Identify the species shown below. So as I told you, multiple rings with multiple dots. It is Plasmodium falciparum का trophozoite stage. It is Plasmodium falciparum का trophozoite stage. ठीक है? Multiple rings with multiple dots. ये हमने बहुत बार discuss कर लिया, right? If a patient requires emergency surgery to survive, but there are no relatives who can give consent, so this is the same one. Surgery is done without consent. Most radiosensitive tissue of body, anybody? Most radiosensitive tissue of body. Most radiosensitive tissue of body, anybody? Most radiosensitive tissue of body. Very good. Dividing cells, important. Dividing cells are affected by radiotherapy. Dividing cells, not non-dividing. Nerves or neurons are non-dividing cells. Okay, they are one of the most radio-resistant cells. ठीक है, याद रख लेना. They are one of the most radio-resistant cells. They are the most sensitive to hypoxia. Most sensitive cells to hypoxia are definitely neurons or nerves, but not to radiotherapy. Radiotherapically, it is the dividing cells. Okay, dividing cells, that is the intestinal mucosa. Bone is all radio resistant almost. Okay, sometimes it is radio resistant. Therefore, in most of the bone tumors, we cannot use radiotherapy. Cleft lip and cleft palate results from failure of fusion of the. So if there is failure of fusion of two palatine shells, that will only lead to cleft palate. But if there is failure of fusion of maxillary and the medial nasal process, that will lead to cleft lip as well as cleft palate. So if the maxillary process and the medial nasal process, they are not fused, it will lead to cleft lip as well as cleft palate. Okay? Most common radioisotope used in PET scan. I'll complete it for you. The most common radioisotope used in PET scan, it is definitely option C, 18 FDG. It is 18 FDG, 18 fluorodeoxyglucose. And इस बार image था PET CT का, red color image, ठीक है? And there was increased uptake of glucose by the brain. That is how you diagnose. Blue color की आएगी अगली बार, so please remember it would be blue color की आएगी अगली बार, so it is PET MRI. ठीक है? Images देख लेना एक बार, रेडियो में डाली हुई है मैंने. And half life of 18 FDG is 110 to 120 minutes. ठीक है? Most common malignancy of head and neck, oral cavity, as I told you. What is the diagnosis based on the given image? So this is what is the, you can see a lesion which is arising on skin. Okay, and that looks like a rodent. The most common site is usually the lower eyelid, या फिर the medial canthus. Okay, but or the lateral wall of nose, but it can occur anywhere. So definitely it is definitely a basal cell carcinoma. Important, basal cell carcinoma is also known as the rodent ulcer or a teardrop cancer. It is also known as a teardrop cancer because medial cancer is the most common site. ठीक है, इसीलिए और एकदम चूहे जैसा दिखता है, इसलिए rodent ulcer बोलता है. Malignant melanoma, here there would be a brown या black spot. ये question आ चुका है, brown and black spot, which would be increasing. Okay, which would be increasing in size. It usually increases in size, progressively increases in size. ठीक है, याद रखना. A patient with old burn scar develops symptoms over the burnt area. It was indicative of malignancy. What is the type of malignancy, anybody? Burns, which is the most common type of malignancy? Usually याद रखना, अगर face है ना commonly and अगर कोई भी blackish appearance है, brownish appearance है, it is more likely to be a basal cell carcinoma. Okay, which is more common usually in the facial region. ठीक है, squamous cell carcinoma is more commonly usually skin over the other surfaces. That is usually the hands या फिर legs या other parts of the body. ठीक है, face पे BCC is much more common as compared. ठीक है, so definitely after a burn infection usually or after a burn, the most common risk is for squamous cell carcinoma. After burns, there is highest risk for squamous cell carcinoma. कौन से ulcers बनते हैं? Which ulcers are there? The pre-malignant ulcers after burns are known as marginal ulcers. Okay, please remember, pre-malignant ulcers which are seen after burns are marginal ulcers, which can further develop into squamous cell carcinoma. Curlings तो stomach में दिखेंगे, skin पे दिखेंगे marginal ulcer, याद रखना. What is the treatment of empyema thoracis? What is the treatment of empyema thoracis? That means empyema, that is pus. Okay, pus in the thoracic cavity. Very good. It should be chest tube drainage along with antibiotics. It should be chest tube drainage along with antibiotics. ठीक है? दोनों करना पड़ेगा हमें. A patient with history of smoking presented to the emergency with breathlessness. The chest X-ray image is given below. What is the possible diagnosis? Right, तुम्हें पस तो निकालना ही है, but infection भी तो है, उसके लिए एंटीबायोटिक्स भी देनी पड़ेगी, दोनों करना पड़ेगा. History of smoking presented to emergency with breathlessness. Chest X-ray is given. On one side you can see there is hyperinflation which is seen. ज़्यादा black दिख रहा है ना? Along with flattening of diaphragm is seen. Definitely it is option B, tension, pneumothorax. Why not emphysema? Because emphysema में there would be a bilateral hyperinflation. दोनों तरफ से there would be hyperinflation. ठीक है? Bilateral hyperinflation होगा. No issues with this, anybody? Hydropneumothorax में classical horizontal line is seen. A classical horizontal line is seen between the whitish opacity and the blackening. ठीक है? The organism which causes the condition. Okay, the organism which causes the condition would not. So the option was other one. Okay, so please remember the option was other one actually. Here the patient, here they have given a classical case of filariasis. Here you can see there is elephantiasis. So this was a classical case of lymphatic filariasis, and they had given that for detection or for diagnosis, we will detect microfilariae. So microfilariae are present in all of the following secretions of body except. Microfilariae would be present in all the secretions of the body except. So as we know, they would be present in semen, they can be present in urine, they would be present in ascites, but they would never be present in saliva. So they will never infect salivary gland. Yaad rakhna, lymphatic filariasis never involves the salivary gland. So microfilariae would not be present in salivary gland. A young male underwent a lumbar sympathectomy and a bilateral L1 ganglia was removed. What will be the most common side effect? Sorry, what would be the most common side effect, anybody? Very good. Very good, very good, very good. Incontinence नहीं होगा. Incontinence नहीं होगा. There would be a retrograde ejaculation. Impotence कब होगा? When bilateral L1 to L5 lumbar ganglia are removed. पूरे के पूरे निकाल दोगे. L1 to L5 bilateral ganglia दोनों तरफ से निकाल दोगे. Then the patient will have impotence. ठीक है? Only bilateral L1 ganglia, it will lead to retrograde ejaculation in the patient. It will cause retrograde ejaculation in the patient. ठीक है? No issues with this. 35-year-old male presented with scrotal enlargement. Investigation shows LDH was significantly high, but the Hcg and alpha fetoprotein levels are within normal limits. Okay. Histopathology image is given below. What is the most likely diagnosis? So as I told you, okay, alpha fetoprotein level or Hcg level is elevated in the germ cell malignancies like teratoma of the testis, yolk sac tumor of the testis, choriocarcinoma mein. So in all these three, there would be elevated levels of alpha fetoprotein or Hcg, right? But in classical seminoma of testis, there would be normal levels of alpha fetoprotein or beta Hcg, but there would be elevated levels of LDH. There would be elevated levels of lactate dehydrogenase. So एक ही tumor marker है seminoma के लिए, it is LDH, lactate dehydrogenase. ठीक है? And this is the biopsy feature that you can see. In between the cells, there are some fibrous septae which are seen. Next one. A 18-year-old male presented to the hospital with sudden onset of pain in groin, scrotal swelling. The image is given below. What is the diagnosis? Young adult male or adolescent male presenting with sudden onset of pain in the groin or the testis, along with scrotal swelling. Image is not given over here. It is a red inflamed testis. It is a red inflamed testis. So what would be your diagnosis over here, anybody? Sorry. What would be your diagnosis over here? So बहुत तेज pain है. Yes, sudden onset of excruciating pain. Sudden onset of excruciating pain. It is definitely testicular torsion. Hydrocele does not cause pain. Please remember, hydrocele will only cause a dragging sensation or heaviness in the scrotum. Never it will cause pain. याद रखना. Okay, hydrocele does not cause pain usually. Strangulated inguinal hernia would be a swelling in the groin, not a scrotal swelling usually. Okay, swelling in the groin, and there would be other features of fever वगैरह भी. Bag of worm is usually varicocele. It is not hydrocele. Bag of worm is a varicocele, dilated pampiniform plexus of veins of testis. याद रखना. Acute epididymolysis can be a probable diagnosis over here. Okay, acute epididymolysis can be a diagnosis over here. For this, you actually do a French test to differentiate. Okay, one of the question which came here, they have mentioned that on elevation of the testis, the pain is relieved. Then it is epididymolysis. But if the pain is not relieved on elevation of testis, then it is testicular torsion. कुछ भी करो, pain relief नहीं होगा, then the diagnosis will be testicular torsion. The treatment is, if the testis is viable, orchidopexy. If the testis is not viable, orchidectomy. And the contralateral orchidopexy is also done. दूसरी testis को भी fix कर दो. In a newborn baby boy with empty scrotum, the testis was found to be lying close to the peritoneum. Which of the following helps the testis to reach the scrotum? So this is nothing but undescended testis, cryptorchidism. So they are asking just which are the drug of choice for cryptorchidism. Again, the answer is GnRH analogs in pulsatile manner. In a newborn male baby, mother found empty scrotum. On examination, the left testis is in the inguinal region, right testis is in the perineum or the iliac fossa, sometimes they mention. Which of the following is correct about this? So as we know, the testes are usually formed in the abdominal cavity and then descend down with the help of tunica vaginalis. They descend down from the inguinal canal into the scrotal sac. Okay, they descend down into the scrotal sac. कोई दिक्कत नहीं है, please remember this. But if they get arrested at the level of inguinal canal, that is what is called as undescended testis. Whereas if they are out of their normal pathway, abdomen में भी नहीं है, ना inguinal canal में है. So if they are out of their normal pathway, then it would be called as the ectopic testis, right? यहाँ पे क्या बोला है? The left testis is in the inguinal region. That means it is in the normal pathway. So it is a left-sided undescended testis. But right testis कहाँ पर है? Perineum में या फिर iliac fossa में. Okay? So right testis is usually ectopic over here. So the answer is B to this option. B to this case. Okay, no issues with this. So it is an important question. Don't make a mistake over here. A patient with history of trauma has ruptured bulbar urethra. What is the location for accumulation of urine? What is the location for accumulation of urine? Anybody? Wealthy. Very good. My goodness. What is the location of accumulation? Accumulation कहाँ होगा वो पूछ रहे हैं वो. Urine accumulation would be in which place? That is what they are asking, guys. कितने बचे यार और questions? I try to cover it. तो accumulation deep pouch में कैसे होगा जरा बताना. Deep pouch में accumulation, why will it happen? There would not be accumulation in the deep pouch. याद रखना, deep pouch में accumulation नहीं हो सकता है. Please remember, no issues with that. Accumulation can never occur in deep pouch. So the accumulation will occur in the superficial pouch. Very good. The accumulation will occur in the superficial pouch. याद रखना. No issues with this, anybody? No issues with this, anybody? Deep pouch में it will not occur. It will usually occur in the superficial pouch. A 54-year-old female presented with history of low-grade fever along with weight loss for the last 6 months. The image of barium study is given below. Here it is not given. What is the most probable diagnosis? So the image of barium study, I'll draw it for you. It will appear something like this. I'm very bad with drawings nowadays. So it is this one. So what is this? Very good. So these are the classical symptoms of TB, right? Low-grade fever or evening rising fever, weight loss, drenching night sweats, and barium enema, which will give this kind of appearance. That is a pulled up cecum. First is the pulled up cecum, and second is the gooseneck deformity. Second is the gooseneck deformity. So here the answer would be ileocecal tuberculosis. As we know, gastrointestinal TB में the most common site affected is the ileocecal junction. So it is ileocecal TB. Treatment would be ATT in the patient. Okay. Ulcerative colitis में there would be a lead pipe colon which is seen. Lead pipe colon is seen. Okay. And there would be diarrhea along with bleeding. Whereas in Crohn's disease, there would be a string sign of Cantor due to stricture. String sign of Cantor. Moving further. And carcinoma colon, there would be a apple core appearance. Carcinoma colon will show us an apple core appearance. So this is again aflatoxin. I'm not going into details. Most radiosensitive tissue, Again, here there is no other option, so mucosa. Whereas the most radiosensitive tissue, please remember, it is the dividing cells, that is your germ cells. Or germ cells का होते हैं usually? So germ cells are usually present at two places, either the bone marrow or the ovaries. That is stem cells, I write better. I'll write the stem cells. Okay. So in the gonads we have germ cells. In gonads we have germ cells, which are continuously dividing cells. Whereas in bone marrow we have hematopoietic stem cells. In bone marrow we have hematopoietic stem cells. So ovaries or testes, that is gonads, and bone marrow are the most sensitive tissues for radiotherapy or radiation. Patient comes to emergency room, vomiting and colicky abdominal pain. On investigation, the following image is obtained. Likely diagnosis. यहाँ पे दिया नहीं है यार. So it was something of this kind. What is this image? On investigation usually, right? This is what is a hand joining sign. This is what is a hand joining sign. Okay, hand joining sign, also termed as the flower vase appearance. Also termed as the flower vase appearance. And this is the diagnosis of horseshoe kidney. The most common site for horseshoe kidney is usually L4. Most common site for horseshoe kidney is L4. On IVP, horseshoe kidney will show us a. On IVP, horseshoe kidney. Identify next one. Identify the structure marked in the given image. Identify the structure marked in the given image. क्या दिख रहा है यहाँ पे? What is marked over here? Anybody? What is marked over here? Which is the structure marked? Anybody? Very good. It is the chordate या lentiform है? Chordate है या lentiform है? Chordate nucleus is the anterior most structure. ये बताया हुआ है ना? Chordate nucleus is the anterior most structure. याद रखना. Chordate is the anterior most structure. This is not the anterior most. Here you can see it is just near the internal capsule. It is just near the internal capsule. और अगर internal capsule के आसपास है, then it is what is the lentiform nucleus. Then it is definitely a lentiform nucleus. No issues with this. याद रखना. And chordate nucleus damage will lead to chorea in a patient. Chordate nucleus damage causes chorea in a patient. Whereas damage to globus pallidus causes athiotosis. Damage to globus pallidus causes athiotosis. And there was a question in NEET PG. There are ringing movements. Okay, ringing large movements of hands. This is what is called as ballistic movements. They classically gave ballistic movements of hand. That is what is known as hemibalismus. And hemibalismus is due to damage to which structure? Hemibalismus is due to damage to the subthalamic nucleus. Hemibalismus is due to damage to the subthalamic nucleus. No issues with this. Please remember this. Internal capsule damage can lead to dense hemiplegia in the patient. It will cause dense hemiplegia, which is usually seen in a middle cerebral artery stroke. Cattle handlers from a village with cough, hemoptysis, chest pain underwent a chest radiograph and is shown below. What is the probable diagnosis? Anybody? What is the probable diagnosis over here? Cough, hemoptysis, chest pain. This is a classical picture of hydrated cyst. Very good. Body packers jo hote, right? Very good. This is a classical picture of option A, hydrated cyst. वैसे तो most common site for hydrated cyst is liver, and over there it will show us the water lily sign or the serpent sign. But the second most common is usually the lungs. Second most common site is the lung. So this is, you can see a hydrated cyst where accumulation of fluid inside it. Okay? Please remember this. No issues with that. Yes, Cassoni's test can be done. Cassoni's test is usually done. What can be the diagnosis for the given image over here? This is the usual finding. If you feel this is not common, this is the usual finding. What is this? Anybody? It is not a iliac crest fracture. It is not a ureterocele. Definitely, it is not a bladder stone. What is this? Rather, it is a foreign body. Okay, it is a foreign body. कहीं गलत जगह पे है, but है foreign body. A patient with history of tuberculosis, prolonged back pain, along with this feature. What is this? Patient में there is a history of tuberculosis and prolonged back pain. So the patient might have port spine. The patient might have port spine, and now there is formation of abscess, and this abscess can involve usually the psoas muscle. This is what is known as the psoas abscess. यहाँ पे क्या होती है? psoas muscle होती है in the retroperitoneum or the posterior abdominal wall. So it is the abscess of the psoas muscle. That is what is called as psoas abscess. कोई दिक्कत नहीं है, डायरेक्ट क्वेश्चन था इसमें. इसमें तो बाकी कोई गुंजाइश नहीं थी गलती की. Identify the given radiograph. क्या दिख रहा है इसमें? What is seen over here? Here you can see there is a distal radial fracture. There is a distal radial fracture along with dislocation of the radioulnar joint. Along with dislocation of the radioulnar joint, distal radioulnar joint or inferior radioulnar joint is dislocated. Definitely the diagnosis is option B, Galeazzi fracture. So Montage and Galeazzi याद कैसे रखना है? So it is usually Mugar. It is Mugar. Montage में ulnar fracture होता है and Galeazzi में radius fracture होता है. Further, how to remember it? Montage में there is a proximal ulnar fracture and superior articulation or superior joint is dislocated. So other way around for Galeazzi. Galeazzi में there would be a radial fracture and the inferior articulation or the inferior joint would be dislocated. No issues with this. So two mnemonics to remember it. And as we know, Montage and Galeazzi both are fractures of necessity. Both are fractures of necessity. So all the intra-articular fracture, okay, the lateral condylar fracture of humerus and Montage and Galeazzi fractures are fracture of necessity. What do we mean by this? They are always treated with open reduction and internal fixation. इनके लिए closed reduction नहीं कर सकते. Here we need to do open reduction and internal fixation. Only a ulnar fracture is called as nightstick fracture. Only a ulnar fracture is called as nightstick fracture. A person at the airport with symptoms shouting agitation and showed the following X-ray findings. He was carrying enema apparatus and laxatives. Which of the following is the wrong statement? Which of the following is the wrong statement? Which of the following is the wrong statement? Anybody? अंदर फट गया पैकेट. Yes, and therefore abdominal imaging is required. Abdominal imaging is required. He's a body packer. Yes, he's carrying all that enema apparatus and the laxatives along with him. Okay, and there is a risk of poisoning. Yes, he's not malingering. Okay, this is a body packer. The person is not malingering. Malingering is the exception. ठीक है, याद रखना. No issues with this. Anybody? Wrong statement. ठीक है. A 65-year-old, यहाँ पे देख सकते हैं ये packets, all of these. A 65-year-old female fell down in the bathroom and sustained head injury. CT scan was performed. What is the likely diagnosis? So here you are getting which type of opacity on NCCT head? Here you are getting a concavo-convex opacity. Which type of opacity? Concavo-convex or a lenticular opacity. Sorry, concavo-convex or a meniscus opacity or a crescent-shaped opacity is what is seen over here. And an elderly patient or a child fell in the bathroom, okay, and after some days the patient presents to you with headache. So the diagnosis is subdural hematoma in this case. Subdural hematoma. Here it would be a biconvex opacity. Okay, rest all I have discussed. Most radiosensitive bone tumor. Anybody? Most radiosensitive bone tumor. As I told you, usually bone tumors are radio resistant. Usually bone tumors are radio resistant, but which is the most radio sensitive bone tumor out of all? Banana shape. Yes, most radio sensitive bone tumor. Very good. It is Ewing's sarcoma. Most radio sensitive bone tumor is Ewing's sarcoma. Most of the bone tumors are radio resistant except Ewing's. Most of the ovarian tumors are radio resistant except dysgerminoma. ठीक है, ये दो स्टेटमेंट है. Identify the mark structure shown by the arrow. क्या दिख रहा है यहाँ पे? What is this butterfly-like structure? This butterfly-like structure is nothing but, this was a question, guys. Very good. It is the midbrain. Butterfly-like structure is the midbrain. Okay. Whereas ऐसा कोई structure देखिए तो upper वाला होगा pons और नीचे वाला होगा medulla. ठीक है. And अगर ऐसा कोई structure देखिए जिसके कोई fans हो, this is what is the cerebellum. Then a 6-day-old neonate with respiratory distress showed the following finding on chest X-ray. Diagnosis बताओ. क्या दिख रहा है? 6-day-old neonate with respiratory distress. Here you can see that the bowel loops are going into the intestine. Sorry, bowel loops are going into the thoracic cavity. So if bowel loops are going into the thorax, there is definitely some of the bowel loops are going into the thorax. That means there is some of abnormal diaphragmatic hiatus, and via this abnormal opening in the diaphragm, the bowel loops are entering into the thoracic cavity. So this is definitely a congenital diaphragmatic hernia. Okay, and the most common type of CDH or congenital diaphragmatic hernia is a posterolateral one known as Bosch-Dalex hernia. Posterolateral one known as Bosch-Dalex hernia. And what is contraindicated in this case? Bag and mask ventilation. What is contraindicated? Bag and mask ventilation. No issues with this. Then identify the structure marked as O on the CT head given in the image below. Okay. So it is not seen properly. Okay. So O यहाँ पे है कहीं. So where there is the crossing of तुझे कहाँ दिखा भाई? मुझे तो नहीं दिख रहा. So it was actually, like, according to my knowledge, it is usually, yes, the most common cause of death is pulmonary hypoplasia in this case, CDH में. यहाँ पे the O was actually marked at the level of optic chiasma. It was marked at the level of optic chiasma. ठीक है? So please remember, it was crossing of the nasal fibers. वहाँ पे O marked था. A chest radiograph of 45-year-old patient is shown below, who has undergone a prior open heart surgery. What is the most likely finding on the given radiograph? What is the most likely finding? यहाँ पे इतना chest radiograph 45-year-old patient underwent a prior open heart surgery. Open heart surgery के बाद क्या प्लेस करते हैं? Open heart surgery के बाद क्या प्लेस कर दिया? Valve. Yes, very good. It was a prosthetic mitral valve. दिख नहीं रहा इतना clearly, but it is a prosthetic mitral valve which was placed. Yes, after open heart surgery, it was done for valvuloplasty. That is repair or replacement of the mitral valve. Okay. और अगर मैंने बोला एक और क्वेश्चन था जहाँ पे you are seeing a cord. Okay. अगर cord दिखता है हार्ट में कहीं, that is usually suggestive. Wire दिखती है कोई हार्ट में, it is usually suggestive. It is usually suggestive of a pacemaker lead. ठीक है, वायर या लीड दिखती है, that is suggestive of a pacemaker lead. Single lead pacemaker, it is usually in the right ventricle. Single lead pacemaker is in the right ventricle. August का क्वेश्चन था ये. Next, what is your interpretation of the given chest radiograph? क्या है यहाँ पे? Classical horizontal sign दिख रही है, एकदम classical horizontal sign दिख रही है, एकदम pure demarcation line. This is what is the case of option C, that is hydronemothorax. This is the case of hydronemothorax. Very classical diagnosis. If it would have been something like this, a curve, then this is known as the Ellis curve or the meniscus sign. So Ellis curve or meniscus sign is a feature of pleural effusion or hydrothorax. It is a sign of pleural effusion or hydrothorax. Pericardial effusion, massive pericardial effusion will lead to a water bottle shaped heart or a money bag shaped heart. Pericardial effusion or massive pericardial effusion will lead to a water bottle shape or a money bag shaped heart. It will lead to a money bag shaped heart. Okay, please remember this. Cardiac tamponade may usually or massive pericardial effusion. Very good. Gold standard investigation for sinusitis, actually it should have been. Okay, please remember. Gold standard investigation for sinusitis. FES के लिए नहीं करते investigation. FES is the surgery done for sinusitis. Gold standard investigation for sinusitis. Gold standard investigation for sinusitis. Anybody? X-ray is the first line investigation. सबसे पहले क्या करोगे तुम? X-ray करोगे. MRI is not diagnostic of sinusitis. PET scan से क्या करोगे? PET CT नहीं है option में. It is only PET scan. PET scan is usually used to detect metastasis. Distant metastasis के लिए करते हो. So it is option D, HRCT. ठीक है? The better option would have been HRCT, high resolution CT scan. ठीक है? What is your interpretation of the given chest radiograph? Again, it is a repeat. It is hydronemothorax. ये commonly repeated question. Pneumonia याद रखना. If there is a consolidation or a whitish appearance, that is what is the pneumonia. Consolidation or a whitish appearance is what is pneumonia. Okay, and they will give you any lobe particularly, and they will ask you which lobe pneumonia is this. So it can be a right middle lobe, right upper lobe, right lower lobe pneumonia. Shortest acting corticosteroid among the following is. Shortest acting corticosteroid among following is. Sorry. Very good, very good. इसके लिए आंसर बता रहे हो पक्का? Okay, हाँ, great. So it is hydrocortisone. The shortest acting corticosteroid among all of them is hydrocortisone, and therefore it is preferred in emergency. It is given IV in cases of emergency. ठीक है? कोई भी एडिसोनियन क्राइसिस में हो water of Frederickson syndrome में it is given IV. Which of the following anti-epileptic drug has highest teratogenic potential? Easiest question. All the anti-epileptic drugs definitely have teratogenic potential, and that will lead to neural tube defects. But the most important one is valproate. Sodium valproate has the highest teratogenic potential, which is the widely used anti-epileptic drug. Okay? And lamotrigine leads to Stevens-Johnson syndrome. It leads to Stevens-Johnson syndrome. Layers of spinal anesthesia. So the layers which will be pierced while giving a spinal anesthesia. Spinal anesthesia is given in the subarachnoid space. Spinal anesthesia is given in the subarachnoid space. So you need to go till the subarachnoid space. Okay, please remember this. So it is skin first of all pierced, followed by subcutaneous tissue, followed by supraspinatus ligament, followed by interspinatus ligament, followed by the ligamentum flavum. And अगर spinal anesthesia दिया है, spinal anesthesia देना है, then even you need to pierce the dura mater. You need to pierce the dura mater. You need to pierce the arachnoid mater, and then go into the subarachnoid space and then give a spinal anesthesia. Current matter. Then give a spinal anesthesia in the patient. Please remember this. Whereas if it is only if it is only a epidural anesthesia, in cases of epidural anesthesia, ligamentum flavum is the last structure pierced. Okay, first structure दोनों में skin pierce होगा. Last structure in epidural anesthesia हमें dura mater को भी pierce नहीं करना, उसके ऊपर ही देना है. So last structure pierced in epidural is ligamentum flavum, but the last structure pierced in spinal anesthesia is the arachnoid mater. कोई दिक्कत नहीं है. Phenytoin has a teratogenic potential, but not the highest one. Okay, it can also lead to definitely teratogenicity, but not the highest. Motor molecules are all of the following except. So all of the following are molecular motors. ये question था. All of the following are molecular motors or cell motors except. All of the following are molecular motors except. Very good. Kinesin, dynein, myosin, all of these are molecular motors. Kinesin, dynein, myosin, all of these are molecular motors except actin. Actin is not a molecular motor, guys. Actin is not a molecular motor. Please remember, this is an important question of physio. Please remember this. And dynein is defective. Dynein is defective in which syndrome? Jaldi बताओगा. Important है. Try idea. Dynein is defective in which syndrome? Dynein is defective in the Carter-Jenner syndrome. Dynein is defective in the Carter-Jenner syndrome, and there would be a triad of bronchiectasis. There would be a triad of bronchiectasis along with RBI mnemonic दिया था शायद मैंने. Okay, so it is R for recurrent sinusitis, R for recurrent sinusitis, B for bronchiectasis, and I for infertility is not included in the triad. Okay, it is situs inversus. I for situs inversus. Infertility is not a part of the triad. Coracoid process of scapula is an example of which type of epiphysis? Coracoid process of scapula is an example of which type of epiphysis? So usually pressure epiphysis are the ones where there is which are responsible for transmission of pressure. That is the head of the femur or the head of the humerus, which will transmit the pressure towards the body. Those are called as pressure epiphysis. Okay? Traction epiphysis are the ones which are formed by the pull of the muscle. This is the mastoid process usually. Okay, that is your traction epiphysis. Okay, and very good. All coracoid process is usually the atavistic epiphysis. The other example is os trigonum. Os trigonum is nothing but the posterior tubercle of the talus bone. It is the posterior tubercle of the talus bone. So both of these are atavistic epiphysis. What do you mean by atavistic? They are formed as a separate bone, but they finally merge or fuse with the main bone. Okay, that is what is the atavistic epiphysis. No issues with this. Aberrant epiphysis is not always present. It is sometimes present, sometimes absent. That is what is the aberrant epiphysis. Leukocyte ruling over endothelial cells of the blood vessel is carried out by which of the following molecules? So definitely rolling. Okay, rolling is definitely a feature of only selectins, and those are remembered by the marker CD62. Selectins का CD marker is CD62. याद रखना. Okay, and they are responsible for rolling of leukocytes over the endothelial cells, whereas integrins are responsible for adhesion. Okay, integrins are responsible for adhesion mainly. No issues with this, anybody? याद रखना. And PECAM1, 2 नहीं, PECAM1 जो होता है, PECAM1 is responsible for PECAM1. All of these are important here. This is CD31. PECAM1 is CD31. PECAM1 is CD31. And PECAM1 is responsible for PCAM1 is responsible for diapedesis. PCAM1 is responsible for diapedesis. Whereas they have asked an important question, which is the most potent chemoattractant? Which is the most potent chemoattractant which is responsible for chemotaxis? The answer is C5A. The most potent chemoattractant is C5A. The other ones can be leukotriene B4 or interleukin 8. Leukotriene B4 and interleukin 8. Whereas if they ask you which is the most potent opsonin, the most potent opsonin is C3B. The most potent opsonin is C3B. The other opsonins can be FC fragment of IgG, FC fragment of IgG, fibrinogen, CRP. All of these are other types of opsonins. Then, which of the following is not associated with cephalematoma? So as we know, there are two conditions, cephalematoma and caput succedaneum. Cephalhematoma, there is accumulation of blood. There is accumulation of blood. Kahan pe? And between the scalp and the periosteum. That is what is the cephalhematoma. It is due to a birth injury. Okay? And usually cephalhematoma is not in its maximum size at birth. Usually it develops 10 to 12 hours after birth. Okay? Usually it starts developing 10 to 12 hours after birth, completely develops by 24 to 48 hours of birth. Okay? And it will go completely develops by 24 to 48 hours of birth, and it will go around by 5 to 6 weeks. It will go around by 5 to 6 weeks. No issues with this? Yes, in hematoma, there will be jaundice because there would be breakdown of the RBCs leading to release of hemoglobin, and that will cause jaundice in the patient. And important, cephalhematoma will not cross the suture line. But if it is only an edema, that is swelling of the scalp, edema hota hai, but swelling of scalp, that is what is called as caput succedaneum. That is what is called as caput succedaneum. Yahan kya hota hai? Only there is an edema or swelling of scalp. So the swelling of scalp can cross the suture line. First thing, okay, it can cross the suture line. It will not lead to any jaundice because blood to any but fluid hota hai. Okay, so these are the important things. And caput succedaneum is present in its maximum size at birth. Okay, it is present in its maximum size at birth, and it goes away by 24 to 48 hours. It goes away by 24 to 48 hours. ठीक है? हाँ, कैप टोपी पूरे सर में होती है कैपुट सक्सेडेनियम में. ठीक है? So now let's study which is not associated with cephalhematoma. Option A says usually involves the parietal and occipital bone. Okay. Option B says bleeding is subperiosteal. Right. Swelling is present at birth. Swelling is present at birth. So usually swelling is not present at birth in its maximum size. Okay? It is usually reabsorbed in 2 to 3 months, as I told you. It is usually reabsorbed in 5 to 6 weeks. The most common site is parietal and occipital bone. So the wrong statement would be swelling is not present at birth. Okay. So the swelling is not present at birth. It usually develops within 24 to 48 hours of birth. It develops within 24 to 48 hours of the birth and then goes up by 5 to 6 weeks of birth. Okay. Then presenting case of an infant with intussusception, management to be done is. So this time there was the image of barium enema in a child, and there was a claw sign which was there, and there was a coiled spring sign. So sign क्या दिखती है barium में? Claw sign and a coiled spring sign. And on ultrasound, which is the investigation of choice, in ultrasound we can see a target sign. Okay. So presenting case of infant with intussusception, guys. Please remember it is what should be done. What should be done? Yes, donut भी बोल सकते हो, target भी बोल सकते हो. So best treatment would be option A. Best treatment is option A. That is fluid resuscitation is given to the patient. Nasogastric tube decompression is done in the patient along with antibiotics to prevent any further secondary bacterial infection, and hydrostatic reduction is done. No issues with this. याद रखना. ठीक है? Hydrostatic reduction is better than pneumostatic. ठीक है? Air से better है पानी. ठीक है? So all of these things will be done. Red currant jelly stools are seen in cases of this one. Intussusception. Aurochs apparatus is used to. Aurochs apparatus is used to anybody. So please, अगर किसी का mic on होगा, please you can mute your mic. Okay? Request. Aurochs apparatus is used for. Aurochs apparatus is used for chlorine demand estimation of water. Aurochs apparatus is used for chlorine demand estimation of water. Whereas free or residual chlorine is detected by Chlorine demand is estimated by Horrocks apparatus, which has 7 beakers. One of them is black beaker containing starch iodide. But free or residual chlorine is detected by an instrument known as fluoroscope. It is detected by an instrument known as fluoroscope. Or the best test to detect free or residual chlorine is OTA test. The best test to detect free or residual chlorine is OTA, orthochloride arsenite test. Okay? No issues with this. Yaad rakhna. Laboratory findings shows high parathormone, high alkaline phosphatase ALP, low calcium and low phosphate levels. Which of the following is the possible diagnosis of the patient? Anybody? So high PTH, that means sorry, high PTH क्यों होगा? Anybody? So there is low calcium and low phosphate level. जल्दी से देखते एक बारी. Hypoparathyroidism में क्या होगा? Low parathormone levels, right? Hypoparathyroidism there would be low parathormone levels, right? Important. Okay. Low parathormone and high serum calcium levels होंगे. तो ये तो है नहीं इधर. So this is ruled out. Option B says osteoporosis. Osteoporosis we know there is normal levels of serum calcium, normal levels of serum phosphate, normal levels of serum alkaline, normal levels of parathormone as well. Okay, so all of these levels are normal in cases of osteoporosis. Don't make, okay, don't make. Please remember, in usually osteoporosis, all the levels would be normal. Don't go for any of the diagnostics. Okay. So the diagnosis over here would be vitamin D deficiency, because vitamin D deficiency में क्या होगा? If there is vitamin D deficiency, there would be low calcium levels, there would be low phosphate levels. Okay, low calcium and low phosphate levels, and due to this, what will happen? There would be excess of parathormone which is produced. So parathormone क्या होगा? Parathormone will stimulate vitamin D production, but vitamin D deficiency से ज़्यादा parathormone produce हो रहा है. ठीक है? So please remember, excess of parathormone is produced, low calcium and low phosphate levels is there. ठीक है? So there the diagnosis of vitamin D deficiency. False statement about fibroadenoma of breast. Jaldi se. False statement about fibroadenoma. Popcorn calcification is seen on mammography. Yes, this is the true statement. Popcorn calcification is seen on mammography of fibroadenoma breast. Surgery is done on patient's request. Yes, usually surgery is not recommended. Only close monitoring and follow-up is done. Okay. Last question बचे पता नहीं कौन है. Close monitoring and follow-up is usually done. Surgery is only done if the fibroadenoma is more than 5 centimeters. That is a giant fibroadenoma, or it is done on patient's request. It is done on patient's request for cosmetic purposes. ठीक है, याद रखना. So this is also a true statement. Surgery is the treatment of choice if size is more than 5. Surgery is done on patient's request, and popcorn calcification on mammography. Increased risk of malignancy is not seen. Okay, please remember. जिसको भी नहीं एक्चुअली करना है ना अटेंड, आई हैव नॉट एक्चुअली फोर्स्ड यू टू स्टे ओवर हियर. ठीक है, एग्जाम मेरी नहीं है, एग्जाम तुम्हारी है. इंपॉर्टेंट बात. ठीक है ना. आई एम नॉट इंटरेस्टेड. मैं आराम से जाके सो सकता हूँ. ठीक है, तुम्हें जाना, यू आर अलाउड टू लीव द सेशन राइट नाउ एंड गो. ठीक है, आई एम हियर फॉर द वंस हु एक्चुअली वांट टू स्टडी. तो मैं बहुत टाइम से देख रहा हूँ. दिस इज नॉट द फर्स्ट सेशन. यू हैव अटेंडेड मल्टीपल सेशन and I have choose not to respond to you. But if you think I'll take it, I'll not take it. Okay. So please remember, increased risk of malignancy. Increased risk of malignancy, please remember, is not seen with fibroadenoma. It is a benign breast tumor. Okay. Next, if I say question number 293, a 44-year-old male came into your clinic post the hernia repair and wants you to evaluate his condition. While eliciting the cremasteric reflex, you notice that the scrotum did not ascend on the side of the surgery, suggesting an iatrogenic injury to the. There would be a iatrogenic injury to the. So इधर वो बस इतना पूछ रहे हैं कि cremasteric reflex is not present in the patient because there is injury to the. As I've already discussed, cremasteric reflex कब होगा? When you will stimulate the inner side of the thigh and there would be elevation of the testis. ठीक है? So जब तुम stimulate करोगे, when you will stimulate the inner side of the thigh, what would be stimulated? The femoral branch of genitofemoral nerve is stimulated. Femoral branch is stimulated, and it will take the sensation, and it will lead to elevation of testis, and the efferent would be genital branch of genitofemoral nerve. So afferent is femoral branch of genitofemoral nerve. Efferent is genital branch of genitofemoral nerve. Okay. So here what has happened? So please remember here, when you stimulate, the sensations are taken, but the testis does not elevate. That means the efferent is not working. Okay, the efferent is not working. That means there is damage to the genital branch of the genitofemoral one. ठीक है, याद रखना. Stimulation जा तो रहा है, but respond नहीं आ रहा. That means efferent is not working. That is what is the genital branch of genitofemoral one. Microbiologist is preparing BCG vaccine in the laboratory. Which of the following is the diluent used with BCG vaccine? So ये हमने discuss कर लिया. These are the reconstituted or lyophilized vaccine which needs diluent. Very good. It is normal saline. अब गलती मत करना please कोई. अरे फिर गलती कहा. Normal saline for BCG it is the normal saline. For distilled water or sterile water is used for measles vaccine. For Japanese encephalitis it is the phosphate buffer saline. And for yellow fever it is the cold saline. ये चार कम से कम याद रखो. 25-year-old female is using vaginal sponge as a barrier contraceptive during sexual intercourse. Which of the following spermicide is used in contraceptive today? So vaginal sponge is famous by the brand name Today, as we know, right? So a young female is using vaginal sponge today as a barrier contraceptive during intercourse. Which of the following spermicidal jelly is usually used? As we know, along with barrier contraceptives like condoms, vaginal sponge, diaphragm, we need to use spermicidal jelly because failure rate बहुत ज़्यादा होता है. And the spermicidal jelly, the chemical present is non-oxynol 9. Okay, it is non-oxynol 9. Please remember this. No issues with this. Nor ethylsterone enanthate is usually given every 2 months. It is given every 2 months, and every 3 months we will give DMPA. Every 3 months we will give DMPA. That is depomedroxyprogesterone acetate, famous by the brand name Antra. The Factories Act 1948 is a social legislation which has been enacted for occupational safety, health and welfare of workers at workplaces. What is the maximum number of work hours per week prescribed under the Factories Act? Very good. It is 48 hours per week. It is 48 hours per week. And with overtime, it is 60 hours per week. With overtime, it is 60 hours per week. मैं बता रहा हूँ. With overtime, 60 hours per week, whereas normally it is 48 hours per week. ठीक है? No issues with this, anybody? 8-year-old boy sustained a fracture to the hand while playing with his sister. In which of the following condition triangular relation of the elbow is maintained? So please remember, triangular relation किसका होता है? It is the medial epicondyle, the lateral epicondyle, and the olecranon. So all of these, when we have flexed, then it will form an isosceles triangle. When we flex the elbow, it will form an isosceles triangle. Whereas when we will extend the elbow, it will be in one line. Okay, when we will extend the elbow, it will be in one line. Okay, so that is what is known as the lateral. That is what is known as the relation of the elbow, triangular relation of the elbow. So usually this triangular relation is maintained in cases of supracondylar fracture of the humerus. It is maintained in the supracondylar fracture of the humerus, but disrupted in the lateral condylar fracture of humerus. It is disrupted in the lateral condylar fracture of humerus. Okay? No issues with this. And supracondylar humerus पे इस बार question था. It leads to a cubitus varus deformity. It leads to a cubitus varus deformity due to malunion, and that is what is called as the gunstock deformity. That is what is known as the gunstock deformity. ठीक है? ऐसे इस type का हाथ होता है. Last 3 questions now. A 9-year-old male child came with complaints of an upper respiratory tract infection. On general examination, he was found to be anemic. The pediatrician explained to his parents about the causes of anemia in children. Which of the following is the most sensitive and specific initial laboratory test to diagnose iron deficiency? The most specific and the best one is definitely option B, that is serum ferritin levels. It is serum ferritin levels. Fall on an outstretched hand, definitely in children can. याद रखना, fall on outstretched hand. Important है. In children, it causes supracondylar fracture of humerus. In adults or in adolescents, it causes scaphoid fracture. Okay, in adolescents, it causes scaphoid fracture. Whereas in elderly patients, it causes fracture of the distal end of radius, known as Foley's fracture. Okay. Next, which of the following inhalational agent is the induction agent of choice in children? So induction agent of choice cannot be desflurane because it is a irritant. Patient start ही नहीं करेगा, वो लेगा ही नहीं. Okay. So the sweet smell is of sevoflurane. Therefore, the induction agent of choice, both in adults as well as children, it is sevoflurane. Okay, it is sevoflurane. In children, for maintenance also we use sevoflurane. In children, for maintenance also we use sevoflurane. The color of vaporizer is important. Sevoflurane has the yellow color. Desflurane has a blue color. Isoflurane has a purple color. Isoflurane usually has a purple color, guys. Please remember. Okay? Yaad rakhna, important है. And last, please tell me, the drug aspirin has been used for secondary prevention of ischemic heart disease because it will inhibit which of the following? So this was the question in NEET PG also this time. Easy one, right? So please remember, it will inhibit, very good, it will inhibit option A, thromboxane A2 synthesis, and so it will inhibit thromboxane A2 synthesis by platelets, and it will block platelet aggregation. It will stop platelet aggregation. Okay, no issues with this? No issues, no issues. Okay. Thank you so much. Now, just remember, all of you have worked hard. All of you will pass. ठीक है, बस दो दिन आखिरी बचे. Important. Just go through the images. Go through important ones. Okay. Any issues, I'll be there to help you out. ठीक है. My pleasure, guys. Thank you so much. Thank you so much. After exam, I'll be interviewing you. Thank you so much, Himanshu. After exam, I'll be more glad to interview you guys or any other session better than that. Sure, party bhi hogi. Thank you so much. My pleasure, buddy. My pleasure.